Hello everyone, welcome to India TV News. I am Anshu Singh and with us we have Dr. Richa Datta, who is an osteopath, and she is going to share about osteopathy and debunk myths around the treatment. Welcome, doctor.
Thank you so much.
Not many people are aware about osteopathy and it seems to be a new term. So in simple words, what is osteopathy?
Basically, osteopathy is a very new science for the people of India. So we need to tell everyone it's an internationally recognized and by WHO and many different bodies. It's a holistic medical science. It's very ancient and yet very modern medical science which was developed in US, America, and now it is all over the world. It is to be done using the hands without any medicine, without any surgery or any non-invasive, any invasive procedure. The treatment of a person is done using only the hands. And the treatment is done at the very root cause of the problem, not just the symptom, depending on the symptom, and you just treat the symptom alone.
So ideally, who can go for osteopathy?
Yeah, osteopathy can be taken from a very newborn, just born baby to an elderly person. So it can be taken from an elderly, pediatric patient, adult, and any person having any chronic issue like back pain, neck pain, sciatica, or the disc bulge. Digestive disorders and the gynecological issue, PCOD, and constipation, and even diabetes and hormonal imbalances.
So what are the techniques involved?
So the techniques are very based on very gentle touch, from the very gentle touch. Sometimes we also do some mobilization, soft tissue manipulations, and there are techniques named as functional technique, muscle energy techniques, and some gentle massage or stretches in the body. So our hands can feel what's going inside the body. If there is any restriction, you can feel the tissue texture changes, and then by doing the technique, that is aligned back to its normal function, and then health is restored.
So are there any diagnoses involved, or are there any tests, say for example lab tests or anything? Do we have those?
Yeah, actually, as the science has developed, we have so many tests, MRI, CT scan, but even MRI, CT scan, X-ray, they tell a static report. But in osteopathy, we can diagnose the movement of the body. If the movement of the spine is restricted, the movement of the organ is restricted, or the brain fluid. So hands can feel and what's going on inside the body. We can either by mobilizing or just by putting the hands on the body and anywhere in the body, we can feel the flow of circulation or the blood circulation or the nervous system. So if the flow is restricted, like in osteopathy, we do the cranial osteopathy. We put the hand on the skull bone, and there is a intrinsic micro movements that are going on inside the brain. So we check whether that movement rhythm is there or not, and then we do the technique to restore it back.
So when a person is taking osteopathy treatment, is that person supposed to modify his or her lifestyle, add some routine to it, probably exercise?
Absolutely, that's very, very important. Our treatment cannot be just based on the by the doctor, based on the doctor. We cannot say only doctor is going to heal you. This treatment modality is based on the self-healing mechanism present within you. So our lifestyle and our nutrition, our exercises, and everything plays a big role. And I've seen many people, those who do yoga practices and exercises, take good care of the nutrition. Osteopathy treatment supports them even better than those who don't follow the good lifestyle.
How would I know when do I need to go to a physiotherapist or an osteopath?
So if you have back pain, if you go to physiotherapist, they will do some technique on the back, right, and then do some stretches. But osteopathy looks into the more holistic picture. They will look at the root cause, that if there is any scar, the stitches is there inside the abdomen, so they will release the scar also. They'll see the alignment of the bones, and if the problem might be coming from the organs, and might be the spine, it's not, if the back problem is there, sometimes the problem might be coming from here. So the root cause area and the symptom area might be different. So osteopathy takes a more holistic approach to find out in different, or from the head to toe, where could be the cause of the problem.
So for example, if a person is suffering from lower back pain or sciatica, ideally how many sessions does one person require, and how long these sessions are?
Good question. Osteopathy treatment generally is prescribed like you have to take 3-4 sessions, and there has to be a gap of 7 days, 5 to 7 days minimum, because when we do something, the principle in osteopathy treatment is you find the cause, fix the cause, and then leave it alone. Why? Because the healing, it's just like wound healing takes 7 days of time. So we treat the person and then we give a gap of 7 days, and then treatment is done 3 to 4 sessions minimum on an average, and then it might take 7-8 sessions, and one session takes 1 hour. Initial session, sometimes first session may take 1.5 hours, but then subsequent sessions take 40 minutes to 1 hour time.
So what are the benefits, or I should say long-term results of osteopathy treatment?
First of all, if you have any problem, it helps in treating that. It helps in improving the health, and then it also helps in preventing the problem. Like if you are taking a treatment of osteopathy, all the organs are functioning properly, your breathing is better, your immunity. So first of all, we are going to prevent so many different kind of illnesses, be it infection, diabetes, blood pressure.
Absolutely. Are there any risk involved?
The only side effect, in fact, I would say the side effect is that it affects all the sides. There are many side effects, but then the one thing that is some people do experience for first 2 days a little bit of soreness, because if the body is aligned in a very wrong position and you are trying to bring it back, so there will be some kind of pull is there, and then how we do exercise after a long time and then we feel soreness in the body, same kind of for just 1 or 2, it's very temporary and then it goes away.
So with this comes myths, there are a lot of myths around it, that only people suffering from osteoporosis should go for it, or people suffering from lower back pain, and it's a painful treatment. What would you like to say about it?
So basically the name of the osteopath, whenever a person comes to me, they come with this notion that it has to do something with only the bones, because osteo means bone, right? So they say that okay, maybe then they relate osteoporosis and then orthopedics, bone related problem, but osteopathy is much more than that. In fact, the name of osteopathy has come like osteo, and pathy means something which is related to bones. Like we live in a house, there are walls around. So first the structure of the even the building is the walls, and then we have the furniture and then the interior decoration, all that. So everything is, if there is wall, then only we can put something inside. So the importance is given to the bones, because the treatment diagnosis starts from the bone, but then we go very much deep into the organs, into the nervous system, into the circulatory system and all that. So osteopathy encompasses all the systems.
If you can just give us 4 or 5 tips on how to maintain healthy body.
So first of all, if we can put the hand beside the chest and then check the breath. So as we breathe in, we will notice that one side our hands go a little bit ahead of the body. The one side chest is expanding more than the other stops before. So after noticing, then now we can check the breath here. Breathe in and we see the difference. At one side the chest is expanding more than the other. So we are giving the message to the body, same message on both the sides, but body is not functioning in line with what we are saying. So then if we turn the head to the right and left also, we will notice that one side the neck goes more comfortably than the other side. So what? Now there is a technique. Why there is imbalance in the body? Because of the wrong lifestyle, wrong posture and all that. So what we can do is, we put the hand just behind the ears, nearly 2 finger distance behind the ear. There's a bony prominence and just behind that. So we can, after putting the fingers very gently, fingertips, and then turn the eyes to the right side. And as we keep looking to the right side, after few seconds of waiting there, we will get the breath automatically on our own, and then we take it. And then we again put the hand back and turn the eyes to the left side. And within few seconds of waiting, maybe 3 seconds to maximum 10 seconds or even half a minute, we get a long deep breath. And then what it does is it aligns the blood circulation. It brings the equal circulation of the blood flow to the brain and equal flow of the vagus, because vagus nerve is coming on both the side, right and left. So after doing the technique, now you can turn the head to the right and left. You will see that both sides now are moving better. Your body restriction is released on its own.
Thank you, doctor, for joining us. We'll be back again with another health expert. Till then, keep watching India TV News.
Thank you so much. Happy World Osteopathy Day to everyone.
Thank you.